Okay, so this is another part of our tutorial here. We're going to be talking about the spinal cord. So we're going to switch over to top of page 30, okay? We're going to go over a few just kind of trivia, and then we're going to buzz through some vertebra stuff, and then we'll be to arthrology. Get ready for this exam one, okay? So cervical enlargement, just our simple level C3 to T1. It's also associated with the greatest transverse diameter of the cord and the vertebral foramen. Okay, that is at C6. Keep that in mind. That specific level, C6, has got a lot going on. Okay, but this is the transverse diameter left to right. Okay, I wouldn't be as worried about the 38 millimeters. I feel like you got a couple other numbers that are probably better to know. All right. Keep in mind the A to P diameter, sagittal diameter, is decreasing from C2 to T1. Okay, and then the lumbar enlargement. This is where it kind of gets a little hairy. So the lumbar enlargement is from T9 to T12 vertebral levels, or bone levels, okay? But L1 to S3 spinal levels, or cord levels. So let me zoom in on my picture here. So the cord ends when we have that cauda equina starting at L1, okay? So the conus medullaris, though, is that little tapering off, okay? Like this little point down in here. And I have a better picture coming up, but this is just kind of for now. But this the conus medullaris is found at L1 vertebral level, okay? So no cord below L1, okay? But we still need all these cord levels to come off, right? So those S4, S5, and CO1 associated with L1. But if you're lazy like me, I really just like to remember this box right here, okay? Because they're all paired off below this. So if you think about it, right? T9 is associated with nerve root L1 and L2, okay? And you just pair it off from there. So if you know your levels, T9, 10, 11, 12, and then no more cord below L1, right? It's kind of easy that way. Do what you want with that, but do recognize there's a difference between the vertebral level and the spinal level, or cord level, if you will, okay? So again, conus medullaris is found at the L1 vertebral level, okay? Nerve roots S4, S5, and CO1, coccyx 1, right, are rising from that conus medullaris, that very tip of the cord there, okay? And then all we have is roots below L1, okay? That cauda equina, horse's tail. Only roots. So that's why we prefer to do like a spinal tap down there, because you know you're not going to hit the cord, right? You get a little more leeway. With that, keep in mind that PIA is covering the cord, right? So once we get down to that L1, and that conus medullaris, that pia mater is going to come together into one strand. Okay, so we call that the filum terminale internum, pia mater. Okay, now sometimes there is, nerve considerations with this that can, have sphincter control, and we'll talk about that in another minute. Okay, but keep that in mind. There might be a nerve in there. Now, once we get down to S2, though, right, we have that dura and arachnoid mater coming together at the dural cul-de-sac. So when that comes together, remember in that subarachnoid space we had that cerebral spinal fluid. So at S2, when that comes together and we get the dural cul-de-sac, you're not going to want to do spinal tap below that, right? Because you're not going to get any CSF. So it'd be kind of silly. So if you kind of look at my other beautiful drawing down here, okay, this purple section here is going to represent the spinal cord. The pia coming down in orange, okay? This one right here, right in the middle, okay? Filum terminale internum coming down. Once we have the dura and the arachnoid following down, right? Once we get to S2 and they all come together and get the collection of dura, now have the filum terminale externum. And you can see it attaches to the coccyx, right? But it's got a special spot that it attaches, coccygeomedullary vestige, okay? It is CO1 and CO2 levels, okay? So you kind of see I have that long line drawn there, but keep that in mind, special little spot for that filum terminale externum to kind of come together there. Okay. The other thing I like to show on this is the cruciate anastomosis. So remember when we talked about our anterior spinal artery running all the way straight down in the front of the cord, right? And we had our communicating arteries running left to right, like I showed here in red, right? So when these come together, we have a cross, or a cruciate, right? So this very last cross that I have drawn with the blue arrow down here, okay, that's going to be our cruciate anastomosis. So just like I have written, it's a collection of vessels with the transverse arterial vasa corona and the anterior spinal arteries coming together. Okay, so that very last cross, cruciate and anastomosis. Now, one last consideration with all this stuff, especially like entire page 31, is tethered cord syndrome. Now, two classifications of this. So remember we said that conus medullaris is at L1. So if the conus is below L1, meaning the cord is being pulled down, right? Like somebody's hanging on a rope, okay? It's kind of putting traction on the entire cord and all those spinal nerve roots attached to it, right? So it could be a bad day. So that's one classification. Or if you have a really thick phylum, right, greater than 2 millimeters, it kind of puts that same pressure on the cord and the nerves, okay? So basically what your body will do is you'll get this compensatory curves, scoliosis and curvatures like that, to try to decrease the tension on the cord. And basically it can cause a lot of problems, as you can see on page 31. Just keep that in mind. Those are kind of our two classifications that way, okay? Make sure we got everything here. So the next part is a little hack I got for you, okay? So I know, I'm sure in CNS Pass, they got you good, but remember our cervicals chill, thoracics tether, lumbars lay, right, for our spinal cord, or our nerve root levels, right? But this is the way I remember the ribs, because this is going to be key too, okay? So we're talking about a vertebral couple. So say right here, get a different color so you can see. So say we're talking T4 and T5, okay? Of this vertebral couple, the superior vertebra is going to be equal to the nerve root coming out of that IVF. So between T4 and T5, we have the T4 nerve, okay? Now with that, the lower vertebra in that couple, the inferior vertebra, is going to be equal to the rib number. So we have rib 5, okay? Just a little life hack. Save you a lot of time, hopefully. Okay, so moving on. Again, I'm just going to kind of skim through this stuff because this is more for lab, and we're going to go right back through this stuff after the first exam, okay? With a little greater detail even. So I'm going to pick out the few, kind of the things to maybe focus on as far as the lecture goes, but again, this is more for lab in my opinion. So C1, I know we said before, atypical vertebra, right? Doesn't have that typical vertebral body and thus doesn't have an intervertebral disc. It has lateral masses, right? That fovea dentis where it articulates with the dens of C2, right? And then ponticulus posticus could be complete, incomplete, developing that arcuate foramen on the posterior arch, okay? Another thing that will probably, it's probably more of a lab thing, but the posterior tubercles, just because they can kind of be, confusing. You have a posterior tubercle, the posterior arch, and posterior tubercle of the transverse process, right? So keep your head on straight there. If we're talking about C2, okay, a couple things to keep in mind is we have the facet for fovea dentis, right, where it articulates with C1. The dens, the big sticky, pokey, uppy thingy, right? And then bifid spinous process is almost always found here. Reliably, anyway. C3 through 5, okay, a couple things to keep in mind is the joints of Luschka, or the uncovertebral joints, the uncinate processes, right? I always think uncinates are up, right? Just kind of easy, and then they're, the lips of the inferior epiphyseal rim is what I have IER there, are kind of the, the protruding parts of the, the inferior epiphyseal rim. So just be able to kind of work your way around those joints for now. We're going to talk about more joints in a little bit, and then hit the joints of Luschka even harder. So just kind of, be able to kind of work your way through the picture maybe. If you have any questions, let me know. C6, the big thing to remember with C6 is carotid tubercle. Basically, the anterior tubercle can kind of get scalloped and moved around because this overarching theme of soft tissue remodeling hard, right? So when this common carotid artery, kind of gets in the way, it can actually remodel this bone. Okay, so usually seen at C6. And then C7 has an AKA. It's the vertebra prominens. Again, we'll talk about these a little bit later, but Now, C7 may or may not be your most prominent vertebra, right? When you're palpating, it could be C7 or T1, as you guys probably know from palpation now. But its other name is the vertebra prominens. So it is always the vertebra prominens. It may or may not be your most prominent vertebra, right? Good. A couple things with thoracics, okay? So T2 through 4. Remember when we talked about the cervicals, we had this lamina pedicle junction. We called it the articular pillar. Again, somebody had the bright idea. Now in the thoracics, we're going to call it the pars interarticularis. Same thing with the lumbars. I just stuck it here because I wanted to talk about it, but keep in mind this runs all the way down. T5 through 8, we have the aortic compression. Again, soft tissue remodeling hard, right? It's a little bit of a flat spot on the vertebral body. You can even see it evident in picture on the picture on page 41. Another thing too to remember, I'm sure they mentioned in lab, but for T2 through 4, if you look at the superior articular process and the inferior articular process, it's a little more like, it's a little wider on the superior aspect, right? So it's a little more like the Honda logo, Honda Motor logo, right? Wider on the top and narrower on the bottom. But if you look at T5 through 8, the superior and inferior processes are straight up and down, more like field goal posts, right? Old school field goal posts like an H. So just keep that stuff in mind. Okay. T1, even if just looking at the picture, very, very flat, right? That spinous process is really, really flat. That's about all I got for T1. T9 and 10, it gets a little tricky when we talk about demifacets. Demifacets are just mean like half of a facet, right? So when the rib articulates with two vertebral bodies and the disc, you kind of get like a little bit of articulation on both, right? So demifacet will be, just kind of key with that kind of stuff. But towards T9 and 10, the demifacets sort of stop. So T9 may or may not have an inferior demifacet, depending on where the rib kind of falls. But at T10, always the inferior demifacet will be absent, okay? Because the ribs are just going to be articulating with one vertebral body. When you get those little floating ribs, the little, like rib 12 is really like a toothpick, right? T11, okay, it's got a reniform body shape, meaning like kidney bean, which is kind of confusing because we said mostly associate that with the lumbar spine. But you can see here, if you're finding it in the thoracics, it's probably not unique to the lumbars, right? Just keep that in mind. And then T12 is kind of special because instead of the transverse process, we don't really have them. Okay, we have tubercles instead. So we have superior tubercle, inferior tubercle, and lateral tubercle. Again, we'll talk about this more, but kind of keep that in mind. Yeah, I'm good with that. So we can hit the lumbars here. We got typical lumbars L1 through 4. Okay, so we have mammillary processes that are unique to the lumbar spine. Also have these accessory processes. You can read more on page 46, but it's pretty straightforward. Also, the transverse process is going to be increasing from L1 to L3, and then kind of go down from there, right? And then L5 is just crazy, right? I mean, it can be wedge shaped, it can be straight, it can be, this or that and the other. It's just basically whatever it wants to be. So that's why I just have variable. It's the most variable vertebra. A couple things to remember with sacrum. Again, we're going to hit this stuff again, but the spinous, it starts off as 5 segments, right? But then it fuses together, so we call it one bone. So when it does that, the median sacral crest is supposed to represent the spinous processes of those segments, right? Median, not medial, median. Okay? Moving out laterally from there, we have the fused articular processes, aka, right, the fused pars interarticularis, right? So that's represented by the intermediate sacral crest, or crests. And from there, moving out even more laterally, would be the fusion of the transverse tubercles, which is represented by the lateral sacral crest, okay? Crests. Just being able to kind of walk your way through that should be pretty good. Coccyx, pretty straightforward, right? Take a peek at it, page 49. Sternum, a couple different pieces, if you will, but we said it's still one bone. So we have that manubrium sterni, corpus sterni, and xiphoid process, all contributing there. We have the sternebrae, right? 4 pieces on the body there. You can kind of see they have the costal notches on the side where the ribs interact or articulate, as well as the jugular notch and clavicular notch. So just kind of take a look at that stuff. It's not too earth-shattering. And ribs, we have 24 ribs, 12 pairs, right, left and right. Page 216 does have probably more information than you care to know about the ribs right now. But there may be like some classifications as far as, are they true ribs or are they false ribs? Do they articulate with the sternum? Are they articulate with, 1 vertebral body, 2 vertebral bodies, So knowing that chart, let's see, what page was it? Knowing the picture on page 32 is really key, in my opinion. So keep that in mind. Again, check out 216 if you really want. And then I just have a chart kind of showing the rib classifications, kind of where they fall with those. Probably overkill at this point, but take a look if you want.